In our Frontline Diaries segment today, we connect with Dr. Daisy Moores, head of maternal and newborn care at the Ottawa Hospital. Dr. Moores, thank you so much for being here today.
It's very nice to be here. Thank you for having me.
I have to say, I have thought a lot about the mums-to-be out there during this surreal time. What has your role been in helping them navigate and get through this?
It's been lots of talking, lots of talking about what the protocols are, how things are different in the hospital, how to keep themselves healthy, how to keep their families safe and healthy.
I gather the partner can be there for the actual labor and delivery, but often not for all of the steps leading up to it, for example, examinations or ultrasound, that kind of thing. Is that right?
Yeah, and that certainly has been harder for sure. And so I have had lots of partners in on, on video calls, on FaceTime, on telephones, and we're doing our very best to include partners, support people, whatever that woman's support circle is in any way that can be done. So lots of technology and virtual access to add to that.
Do women wear masks when they're giving birth?
Yes.
Why is that? To protect the staff?
The masking is so that we all keep each other safe. So all of the staff are masked, support people are masked, women having their babies are masked. And so if everyone is masked, then the transmission is lower for everybody.
Okay. Can you tell me a little bit more about the special mom and baby COVID-19 clinic? What happens there?
Yeah. So we modeled that clinic after a clinic called the Monarch Center, which is an existing clinic in Ottawa that sees mums and babies and their families after discharge from the hospital, usually for the first couple of early visits. So they come in for any kind of jaundice follow-up, feeding support, and new baby assessments, and there's lactation consultants that you see. And so we set up a clinic at the hospital. In the initial time, we ran it out of one of the anesthetic units that was closed down temporarily, and we saw all mums and babies post-delivery for their usual newborn care. We could do blood work there, we did a lot of feeding support, and they were cared for by staff wearing full PPE with cleaners who could do all of the necessary housekeeping and manage those potentially at risk or risky families in a way that a normal community-based clinic wouldn't be able to do because of the equipment and the cleaning.
Okay, and you are a mom as well yourself, stressful time for families with kids of all ages. How do you manage to sort of escape from it all with your boys?
Yes, I have 10-year-old twin boys who have been great through this whole time, and am lucky to have a partner whose job morphed to working at home very easily. So the three of them have been a gang at home for sure. And I think what a lot of people have done, we get outside, especially through the early part of the spring. We did a lot of running, a lot of biking, a lot of walks, lots of card games. My kids are euchre sharks now, which is fun. And just, as everyone has done, we've all made it work. And that's really what I've been not surprised by, but I've been so impressed at the resiliency that we have seen, both in our patients and in the community and in the care providers that I work with. I mean, everyone has risen to just dealing with this and taking care of themselves and everyone else as best they can.
And finding those silver linings. All right, well, Dr. Daisy Moores, thank you so much for your time today. All the best to you.
It was a pleasure. Thank you.